Okay, great. I'm gonna do a fairly quick overview of Medicaid for All. Medicaid for All in the U.S. and what that would look like, and how possibly framing this as a managerial issue rather than a political issue can help uh, people understand what other countries do and how you could actually fund something like this. So, again, just I'm kind of looking into this on Labor Day, and I made some images here for public health insurance option. So this presentation is going to be 10 slides, pretty much introduction, how key points about how this would work with coexisting private insurance, funding, and comprehensive services, and state collaboration, possibly state rollout, and that would be based on past programs that have been successful at state level, and some success stories and sort of a path to equity. So again, in public insurance option, public health insurance option, and like sort of reframing this maybe from Obamacare and Affordable Health Care Act to Medicaid for All or Medicare for All. So again, this presentation is really about framing this as a managerial problem. So, Romney Care is one of the sort of success case studies implemented in 2006. Was a successful state healthcare reform that significantly expanded health insurance coverage. A key feature of the plan was the mandate requiring individuals to obtain health insurance. So if they didn't, then they would have to have a fee. In this case, the fee would be $900 or $75 per month. This mandate helped generate funding to support the program. So basically, everyone would pay $75 per month, and possibly people who have private health insurance would still have to pay the $75 per month. But starting off, there would be a phased rollout where you would just pay $75 per month, even if you didn't want to enroll in this program, Medicaid for All. So again, thinking of it more collectively, Mitt Romney has discussed healthcare as a managerial challenge, emphasizing that if everyone contributes a little, the collective cost can be managed more effectively. He articulated this view by saying that mandates are necessary because they encourage personal responsibility. If someone can afford insurance but chooses not to buy it, they should set aside funds to pay their own way when they need care. This principle was central to success of Romney Care in Massachusetts. So, and later influenced the Affordable Care Act or Obamacare. So again, I made some pretty AI public health insurance option images in what did I use? Possibly Midjourney, Dolly 3, or Copilot. Okay, so slide 1, just like, what is this? Medicaid for All, expanding access to affordable health care. And this is just a comprehensive look at it. Slide 2, what is Medicaid for All? So it would be a public health insurance option, expands Medicaid to all Americans. So if you wanted in, you would pay $900 a year, $75 a month. And this would be funded through contributions of mainly through voluntary enrollment at first, and then it would be a phased coexisting premium with private insurance. So the next, the need for Medicaid for All. Why do we need this? Well, we have 27.5 million Americans that lack health insurance, and I'm pretty sure if they could know that they could do health insurance for $75 per month, even a lot more people would do this program than that 27 5 people. And the high cost of healthcare, expensive rising costs of these private companies that um, you know are just passing the buck along, and sort of warping the system to their best to make the most money, and instead of framing it as a managerial problem. So healthcare disparities, more people are having trouble with access to healthcare. So choice for consumers. So if we can provide a public option that would control cost and sort of give a base stone pricing point for consumers in the market. So and then private insurance would continue to operate with no disruption. So again, it's your own Cigna, Blue Cross, Kaiser, Permanente, whatever you have, you would just keep. I'm sure with the new ability to negotiate Medicare or prescription drug prices, private insurance companies are going to pretty much will understand that they have to compromise a little bit if they want to play ball. So enhanced competition. Again, this is the public option encourages competitive pricing. Medicaid, how is this funded? $75 per month, especially for voluntary enrollment for maybe the first 10 years. And then if all Americans did it, eventually it would generate $305 billion annually. And this aims, again, to managerial costs of lowering the Medicaid that's 65 and older, $8,000 per year per enrollee costs. So I think we could do this with a $900 contributions to cover the $8,000 cost at just using at scale buying, wholesale buying, and just like sort of the efficiency of sort of a public system. What does Medicaid for All cover? So comprehensive services, including primary care, hospital services, prescription drugs, preventive care, which would be a major shift in sort of the focus of sort of the heroic emergency room type healthcare that we have currently, and then affordable out-of-pocket costs, so low co-pays, and virtually it would be a $75 copay per month. Benefits of Medicaid for All, universal access. So if you can afford the $75 per month, you are in. Cost savings, reduce overall healthcare spending through economies of scale. So I just was talking about that. Your buying power and your you sort of tackle this in sort of as a managerial issue. Healthcare is really about all these numbers and things, and I think there's a lot of data there that we are lose out on just because it's all private. So again, closing these gaps on these with private insurance companies, and sort of emergency room type healthcare that we have currently. So, and then maintains consumer choice. So it's like, geez, where's the cheap insurance, right? Well, this would be the cheap insurance. So again, phased rollout. How would this be implemented? And I would think a lot of state and federal collaborations where the state actually implements a lot of these through maybe existing healthcare networks and partnerships. And then public awareness campaign, educating people what is Medicaid for all. And then again, private insurance would say the same. So funding sufficiency would be $75 per month for every sort of 300 million people in the country, but that would be sort of a phased rollout, and you would sort of only charge voluntary people at first, and then later it would become a mandate. And then provider participation, encouraging healthcare providers to accept Medicaid for all, and then coexistence strategy where public and private would just complement each other without conflicting each other. So if you really wanted a specialist or specialty, maybe just some exotic healthcare or specialty insurance, perhaps, then maybe you would go buy out with private. So success stories again: Romney Care, Massachusetts, and then Oregon, 1994 Oregon Health Plan. Oregon's Medicaid expansion introduced prioritize health services, allowing more residents to receive coverage. The program has noted for innovative approaches to expanding access to health care. So, summarizing key points: affordable, comprehensive, and equitable health care for all, and really framing this as a managerial problem, and call to action: support Medicaid for all to ensure every American has access to quality health care while maintaining the option to choose private insurance. So thank you, and then again, some more AI images. I make public health insurance option. And please comment if you have a